Our guest now, Representative Anthony Weiner, Democrat from New York, member of the Health Subcommittee of Energy and Commerce. And we're told you come to the table with some new health care information that your office compiled. What do you have to tell us?
Well, it's more kind of another way of looking at this debate and discussion about the public option to put in focus. We wanted just out of curiosity and looked how many members of Congress get the public option. And I know a lot of people have said, well, under the new bill, how many of you members of Congress would choose the public option? Well, there already is one. It's called Medicare. And we found that 55 Republicans and 151 members of Congress are on Medicare right now. So they're already getting the same type of public option that we'd like people who are without insurance to be able to get. And I guess the purpose of this list was to kind of point out some of the hypocrisy of this debate. You have members of Congress thumping their chest how they're against government health care, against government-controlled health care and socialized medicine, and yet when it's time for them to accept Medicare, they're like, sign me up. And part of what I've argued in arguing for a single-payer system is that, well, we have Medicare for those that are 65. Why not 64? Why not 24? Like, you're about 24, I'm sure.
Sure.
And why not have that type of a system that has lower overhead, lower costs, and you don't have to deal with the 30% in profits and overhead that insurance companies take. So we compiled this list largely to point a bright light on some of the hypocrisy of this debate, but also I hope it gets people thinking, if Medicare is good enough for 151 members of Congress, why shouldn't a program like it be created for those who want to go out and buy insurance?
So